Mrs. Hansen needed a stem cell transplant. We don't do those here. It would be nice to be able to send her to the best place in the world to have it done. And we can do that. They're right down the road.
If I were a community physician, it would be very important to me to know that I had the ability to offer my patient the very best care at every stage of their disease. By partnering with an organization like the SCCA, the community physicians can honestly feel that way.
Magnesium oxide. You know, everybody with cancer would like to be cured of their disease. We would all like to live forever, but I think what people really want and deserve is to feel like they have had the best opportunity to do well.
And what's been going on?
The multidisciplinary clinics that we have with multiple specialists all converging to focus on a single patient's care is a great advantage.
So it's actually more important for women to have colonoscopy.
They can send the patient here for a second opinion or for that initial episode of therapy if they so desire. For other patients, it may be getting therapy late in the course of disease when there is no established therapy and they want to be getting a more experimental new therapy that may be only available at a place like the Seattle Cancer Care Alliance.
And we'll be checking your whole body and...
the fact that they can actually call in directly and usually within minutes speak to a specialist is a real plus. And those calls are made all the time.
In all situations, we want to have open dialogue with our referring physicians. We want to make sure that the patients are coming here for the right episode of care and getting back to their referring physicians when what we offer is no different than what would be offered by the referring physician.
I am mildly concerned about this increasing shortness of breath.
You know, some people do well, some people don't. And I think that you always want to be able to look yourself in the mirror, and you always want your patients and their families to be able to look themselves in the mirror and know that everything possible that could have been done was done, that they received the best care at every step along the way.
So it really looks great, and we really are down to just needing to do his scans one more time.
There are far more patients with cancers than there are physicians to treat them, unfortunately. And so this isn't an issue of competition for patients. By partnering, I think we can provide the very best care for patients, and at the same time, we can advance our mission, which is to eliminate cancer as a cause of suffering and death.
That's really the name of the game. You know, that's what we all come to work to try to make sure that that happens every day.